morning, Amy. My name's Michelle and I'm your trainer today. Today's lesson is going to teach you how to use a tympanic thermometer as opposed to the Hill-Rom automatic thermometers on the trolleys. So the Hill-Rom thermometers are extremely accurate, but they can break down, and they do break down quite often. So knowing how to take a tympanic temperature is a very important skill to have. So that's what today's lesson will be about.
Okay.
Sorry, I didn't introduce myself. My name is Michelle.
Yeah.
I am a trainer from Lifebeat First Aid Training, and as I said, we're going to teach you how to use a tympanic thermometer.
That's nice to meet you.
Right. So, first things, I just want to explain to you how much do you know about parameters of temperatures?
Not really that much in terms of people.
Okay,
Yeah.
okay. So a normal temperature measures between 35.4 degrees and 37.4 degrees. That's your normal range. A moderate temperature, where it's getting up a bit and you probably need to take something for it or seek some help, is between 37.4 and 38 degrees. Anything 38 degrees and above is considered a high fever. So for a lower grade fever, as we were talking about, the 35.4 to the 37.4, the danger of having a low fever, a low temperature, is becoming hypothermic or having hypothermia. I'm sure you've heard of that term before. Yeah. So then we need to warm up the body quickly using heated blankets or a blower heater on the body. With a high grade fever, the dangers of that are febrile convulsions, which can lead to possible brain damage. And the way to treat that is to Panadol every 4 hours, and have a lukewarm shower, use of ice around the neck and the armpits. That brings the body temperature down. But you do still need to keep an eye on it, very close eye on the temperature.
Okay.
Okay, so I have here what's called the Omron MC310 thermometer, or I'll show a 510. Sorry, I'll show you on the PowerPoint how the parts and how we use it.
Sure.
Okay, so the parts of the thermometer, you have, I'll pull this one out as well so you can see it. So we have the infrared sensor, which is this part here. We have and that is the probe. We have the probe cover, which goes over the infrared sensor, clicks on there. We have the on measure switch, and we have a display screen. Okay, so they're the parts of the tympanic thermometer. So to operate the thermometer, as I said, we just listen, we push that on, you'll hear a loud click, and you'll know that that is on there and secure.
Okay.
Okay. Now, taking the temperature, we press the on measure switch at the top, and we wait for that C there to flash. So you can see that's flashing now. Okay. It will still have the recording of the last temperature taken.
Okay.
All right. We also, I should have mentioned, I apologise, but we also use a new probe cover with every single patient, and that's to stop infection, cross-contamination. It's just much more hygienic. Yeah. So, to use this thermometer, we pull the helix, which is this part of the ear here, we pull that up and back, and then we place the thermometer probe into the ear canal. Okay, and then we depress the button on the top until we hear 2 beeps. it may not do that right now because we have to wait until it's still in the ear. And while it's in the ear, we press the on measure button again, which will, and the unit will measure, and it will measure the highest temperature. So what you do need to do is sort of move the thermometer just a little bit sideways in the ear canal, so that you do get all the temperatures, because temperature can measure on the ear canal, but you want to go in further to get the internal ear measure. So when you hear 4 beeps, the measuring is completed, and you can remove it, and that will give you your reading, your temperature reading. So, do you feel that you would like, do you have any questions at this time?
Not that I can think of, no, I haven't explained it easily.
Okay, fabulous. So, what I'll get you to do is to press the on button, and then you can, and press it until the little seed flashes. So it's flashing, beautiful. So what you can do now is you can use my ear to measure. So it might be easier if you stand up.
Alright, so hopefully I don't hurt you.
No, you won't. So you pull it up and back.
That's comfortable?
That is, yes.
Alright.
Pop that.
Is that okay?
It's got to go in further. Okay.
Further, is that fine?
That's fine.
Yep.
Right.
And then press on measure. Sorry?
Yep, correct. Hear the 4 beeps.
Yep.
Press it again. And take it out of the ear. What does it measure?
35.
I'm a bit cool today.
Yeah, I guess so.
Yeah. So that was pretty good. So in the case here, we have spare probe covers.
Yep.
So if we'll take that one off, because I've used that in my ear. And what I'll do is I'll put a fresh one on.
And these are disposable, are they?
They are disposable, yes. But they can be used on the same person. So just click that on. So you can leave the probe cover in the patient's room.
Okay.
Okay. So now you will have the C flashing on there. And I will measure your temperature.
Sure.
So you can feel what I was feeling. So pull that up and back. We place that in the ear. How does that feel?
That's fine.
Yep. That's 4. Press it again. Okay. Now, so your temperature, 35.1. And I'm guessing it is because your hair is wet.
Yeah, it's wet.
It's wet on your neck, so it's keeping you nice and cool
Yes.
as well. Okay, so what we can do now is we can practice, and I do have another person here that you can practice doing that on, but before, what we'll do is you can practice once again on me.
Yeah.
We'll use the other ear and we'll see if we get a different reading.
Sure. Okay. So, do that.
Mm-hmm.
And that comfortable?
Yes, it can go in a bit further.
Yeah.
That's better. So, yep.
There we go.
And what does that say?
35.2.
I'm getting warmer.
A little bit warmer. Been up and moving around, so.
Lovely. Okay. So, what I'll do now is, that was your cover, that's my cover. I will get another cover out.
Sure.
And we'll take Wayne's temperature.
There we go.
Bit tricky, that one. It's actually very handy having these probe covers
Just ready to go.
just sitting in here. Yeah. Okay. I'll actually let you put that one on because I don't think you've done that part yet of the procedure.
Okay, so.
Click. Feel how it clicks on there?
Yeah. Pretty quick and simple.
It is. Okay. So if you would like to test Wayne's temperature
Alright.
and see. It is always good to have other people to practice on
Exactly.
because you get a feel for different ears and some people have shallow canals, some people have deep ones. So,
Yeah.
Yeah.
Alright, so just let me know if I hurt you or anything, if it's uncomfortable. Alright, so pull that back. Is that fine?
Mhm.
35.2. You're all
Okay.
good.
We're all on the cool
I
side.
guess so.
I guess because it's a nice cool day,
It
which is lovely.
which is finally a thing that we're dealing with.
Definitely. Okay. So, do you have any questions now?
So why would I need to take temperatures in general beyond, say, checking for hypothermia or a fever?
Okay. Because when people are ill, a high temperature can also be an indicator of an infection within the body, which will then need to be reported. So the person may need antibiotics to get the infection under control, which then will in turn bring the fever down.
Okay.
You just doing observations every 4 hours. So you do the blood pressure, oximeter, and temperature.
So it's part of a big suite of...
It is,
Okay.
yeah. Usually we don't just look at taking a temperature and looking at it on its own. There will be other symptoms or signals that you'll pick up in a person that relate to having a fever. They might be bright red and flushed in the face. You might notice a cut or something that looks red and nasty, and that could be your indicator that that's what is infected and that is what is causing the fever to happen in the first place.
Okay,
Yeah.
Alright.
Okay. So, any other? Does that answer that question for
Yeah,
you?
it does. Can't really think of any other ones. But yeah, no, that was, yeah.
That was okay. Fabulous. That's wonderful. So, I guess what we can do now is just practice a little bit more and just see if we can get some other readings. Let's see if my temperature has gone up anymore.
Okay.
So I'll pop that one back on there for you. There you go. It's actually turned itself off now. It's gone in sleep mode.
So that.
Turn it on. Wait for that little C to start flashing again.
There we go. Alright, which ear did you want? Left ear?
It doesn't really matter. You choose.
Okay,
You
I'll do
decide
your
which ear. Okay. So I might need to go in a little bit deeper. That's it.
Gone up a bit. 35.9.
35.9.
Yeah.
Wow, I'm heating up
I guess
nicely.
so.
Okay. And what I will do is I'll do your temperature again so that
Sure.
you can feel how deep the probe should be going in there, okay?
Okay.
Alright, so we'll do another demonstration. We'll see if your hair has got you any warmer yet.
Yeah, let's hope.
We'll wait for that. There we go. We have a flashing C.
Yep.
And up and back. We'll pop that in. Okay. I know that did beep, but I'm just wondering, I'm thinking that this machine has taken the previous temperature.
Yep.
As the same, because it's saying you're 35.9 as well, which
Okay.
I don't think is quite.
We'll try it again.
Try it again.
Yeah.
We'll try the other ear and see how we go,
Yeah.
shall we? Alright. So, let's try that. Okay. Ah, there we go. 36.1.
There we go.
There, perfect. So it is working properly. Okay, so in conclusion, we've taught you today how to use the Omron MC510 tympanic thermometer. Do you feel confident that you would be able to take a temperature on a person now using a manual thermometer like that?
I should be, yeah, definitely.
Awesome, that's fabulous to hear. You've done a really, really good job today, and I thank you very much for being a part of the lesson today.
Thank you so much for teaching me.
Thank you.